This is a solo eating enlightenment podcast, one of the first solo episodes of season 2 of the Eating Enlightenment podcast. I'm going to be talking about binge eating disorder treatments, and this podcast was originally aired as a YouTube video on the Eating Enlightenment channel. Check out eatingenlightenment.com for more information, including whether or not you have binge eating disorder, and stay tuned to the end of the episode for more information. Without further ado, welcome to the show. Let's give an overview of binge eating disorder treatment. This video is going to cover the 4 types of binge eating disorder treatment that I'm familiar with. There's a 5th type that also has a lot of research and evidence behind it, but I'm going to be covering the 4 main types that are clinically backed, that have a lot of research behind them that I'm familiar with. I'll give you an overview of these 4 different types. And we're also going to be talking about what you need to know before you commit to a certain path. The first thing I want to cover is what you need to know before you commit. There's 2 things that you need to know before you commit to binge eating disorder treatment. So binge eating is where you overeat, you feel horrible afterwards, you lose control. Before you commit to getting treatment for that, these 2 mindsets are going to help you a lot in your decision-making process. In this decision-making process of like, which binge eating disorder treatment is best, it's easy to get caught up in searching for quote unquote the right treatment. You want to find the perfect treatment. It's not that these treatments are, the differences between the treatments are insignificant. The differences between treatments are significant, but a more helpful mindset is to realize, find a specialist, somebody who concentrates on eating disorders. Find someone who is giving out a lot of wisdom, who's making a lot of sense to you, who has a proven track record. Find someone who specializes in eating disorders, because a competent therapist, coach, or counselor who really has studied eating disorders, they're going to draw upon these different therapeutic techniques. They're going to draw on these different binge eating disorder approaches, and they're going to make art. They're going to weave these different tools and principles and theory, and they're going to weave it together to create an individualized experience for you. As a client's perspective, as someone who is looking for a binge eating disorder treatment, I understand that what your priority, your mindset might be. What's the best one? What's the right one? Which one is best for me? Like blah, 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 blah. Find someone who's an expert. And trust them. Trust that you're going to do some art with them, that there's going to be some sort of mutual giving and receiving, that person is going to be able to tailor these different approaches for them, these different binge eating disorder approaches to you. Okay, so that's the first thing I wanted to cover. And there were 2 things that you needed to know before you start seeking about binge eating disorder treatment. Oftentimes when someone is questioning binge eating disorder treatment, if they should go into it, if it's right for them, a big fear comes up. And that is that basically you'll have failed even after going through treatment. You will still be overweight. I want to separate right now for you these different treatment outcomes. There's weight loss, and then there's ending binge eating. When you go into binge eating treatment, it's to end binge eating. It's not for weight loss. Now, doesn't mean that you're going to gain weight. Doesn't usually happen that way. But what it does mean is that it's not about weight loss. Success in binge eating disorder treatment is ending binge eating. Okay? There's lots of health benefits to ending binge eating. Many, many health benefits if that's where you're coming from. Binge eating is not good for your hormones. It's not good for your stress levels. It's not good for it's not good for your body. So ending binge eating is going to help give you more energy. And even from a mental health perspective, there's tremendous anxiety and stress, and these things can really take damage on your heart, your nervous system. It can just ruin your energy and put you in weird moods all day. Ending binge eating is going to bring a peace of mind, a stability to your mental health. Between the mental health and the physical health, these are amazing treatment outcomes, and they do not include weight loss. So we need to separate. Weight loss is different than energy. It's different than peace of mind. It's different than eating healthy. It's different than reducing the pain in your body. It's different than ending binge eating and not being bloated. It's different than being able to hang out with your friends, okay? Oftentimes, people, understandably, because weight loss and binge eating are so intertwined, and because the diet industry is horrible, don't get me even started about the diet industry. It's just malicious. It's horrible. Okay, I'm not going to go into a diet tangent. I'm just not. It's very easy to get confused about binge eating and dieting and weight loss. Weight loss is like separate. You can still have amazing health outcomes by ending binge eating, but you have to stop with the weight loss. You have to focus on the binge eating first. And down in this article, down below, if you're watching on YouTube, and also if you're listening on the podcast, there should be a link to an article that covers like the different stages of ending binge eating. First, you stop the binges and you get some binge-free stability. And then I also include a diagram that does talk about weight loss, just because some people need to have it in their head that after they stop binge eating, then they'll lose weight. I don't care if that's what you think. I just want you to stop binge eating. When you stop binge eating, you will see through that dieting doesn't work. And so that when you do attempt weight loss, or when you do start to shift gears a little bit and consider weight, you'll be in a position where you're not depriving yourself. You'll be in a position where it's gradual, really gradual. You'll be in a position where it's not desperate. All right. So ending binge eating doesn't mean you'll never lose weight. It doesn't mean that you won't have amazing health outcomes. It doesn't mean that you won't be a success. It just means that while you end binge eating, you don't focus on weight loss. That's it. If you do choose to focus on weight loss in the future, you'll be much better prepared to do so in a way that won't harm you. Okay? Because weight loss for many people is harmful. Has weight loss helped you in the long run, or has it led to binge eating and weight gain? That's the question. If weight loss hasn't worked for you, then are you willing to try something else? Okay? And lastly, we are approaching we're going to talk about these different approaches to binge eating disorder now. And there were 4 different approaches that I mentioned, with a 5th one that I'm not familiar with. And then there's also medication, which I'm not familiar with. So I'll be honest with you, like, I'm not familiar with interpersonal psychotherapy. That is IPT. IPT focuses on relationships, and I'm not familiar with it. It does have clinical backing. In the article down below, there's a link to an IPT resource if you want that. I'm not also familiar with medications. My perspective on medications for binge eating disorder treatment is that in extreme cases, in some cases, they can be useful, but there can be downfalls as well. There can be negative health effects. And so if you're thinking about medication and you don't really have this, if you're binging every day of the week, you might need some medication. If you're not binging every day of the week, try to get rid of the binge eating without the medication. That sound fair? That's what I would say. For some extreme cases, medication is good, but many times it's just better to learn how to do this on yourself and become empowered to do this on yourself. So I'm not going to talk about IPT. I'm not going to talk about medications, but I will go through briefly these 4 different types of binge eating disorder treatments. We have cognitive behavioral therapy. We have acceptance and commitment therapy. We have dialectical behavior therapy, and we have intuitive eating. So we're going to go with the traditional model first and then move into the more new age models. The traditional is cognitive behavioral therapy. It's the gold standard of therapy. It's the most well-researched therapeutic technique in the world. And it deals with directly changing your thoughts. It focuses on analyzing whether thoughts are true or false. It is simple. It is simple. It's very simple. Now, there is a specific form of cognitive behavioral therapy, CBTE, which has been designed for all types of eating disorders. They have this fancy word, quote unquote, transdiagnostic. So this type of questioning of getting the thoughts, of changing the thoughts, of understanding whether thoughts are true or false, this method can be used across eating disorders, from bulimia to anorexia to orthorexia to binge eating disorder, FEPC. So we have this approach, which works really, really well. Now, this approach also talks about nutrition, and it just reminds me of how all these approaches talk about nutrition. These approaches all have a lot in common. They have more in common than they do in differences. So even though I'm going through the unique qualities of each treatment, please keep in mind that they all talk about nutrition. They all talk about stress reduction. They all talk about ending dieting. They all talk about understanding these things. They just talk about it in a little different way. So that's why, in the hands of a skilled clinician like myself, these different therapeutic approaches are tools that I use to sort of paint. They're like different musical instruments that I play with each individual client. Sometimes I'm playing a flute, sometimes I'm playing a guitar, but sometimes I'm using cognitive behavioral, sometimes I'm using intuitive eating, but they all kind of blend together from the clinician's point of view. Anyways, let's get on to the newer therapies, which were acceptance and commitment therapy, and then there was dialectical behavioral therapy. The main thing that's interesting to note about these is that cognitive behavioral therapy was developed in the 1980s or so, and it dealt with directly changing the thoughts. While this is cliche, you can think of it as think positive. No, that's too cliche. That paints it in too bad of a light. But there is some sort of directly changing the thoughts, asking, is it true that it's likely you will, that this anxiety will kill you? No, it is not true that this anxiety is likely to kill you. So you can question a thought's trueness or falseness using cognitive behavioral therapy as a quick example. These other therapies, which were developed post the mindfulness revolution, we have this mindfulness revolution, lots of research that really influenced these therapies. And these different therapies, they focus on being in the present moment. They focus on being aware. They focus on developing a foundation of awareness where you're aware of your feelings, your thoughts, your body, whether you are panicking, whether you are calm, understanding what thoughts you are having. And then instead of directly changing the thoughts, as in CBT, they really focus on changing your reaction to the thoughts. So if anxiety is coming up, how do you respond to anxiety? If you are thinking negative thoughts, how do you respond to those negative thoughts? Does thinking a negative thought mean that you need to act on it? Does thinking a negative thought, for example, let's say you know you need to eat more food and you say, oh, I can't do it. Does thinking I can't do it, does that stop you from taking a little step forward? You can take steps forward, little steps forward, even if you think you can't do it. Another way of managing reaction to thoughts are going through these different in dialectical behavior therapy, they teach you these self-soothing mechanisms, which are used to calm stress down, to calm reactions down, to manage the energy. So in CBT, it tends to try to change the energy or thoughts directly. In these other approaches, you have energy, and now you're trying to soothe the energy. You're not trying to make the energy go away. You're trying to channel it differently. Can you distract yourself? Can you use your senses? Smell, touch, taste, music. Can you get in touch with your senses to distract you? Can you calm down? Can you go on a walk? Can you get outside? Can you ask for help? Are you aware of what triggers you? These types of things are all tools and strategies that are incredibly helpful. They really are incredibly helpful. And they're examples of how you can learn to manage energy. You can learn to manage these feelings of stress and so forth. Lastly, we have intuitive eating, which is sort of a hybrid between all these approaches. It emphasizes a lot more, I'll say, quote unquote, embodied. It's very embodied. It's about hunger. It's about fullness. It's about satisfaction. It's about understanding how you think about your body image. I would say intuitive eating is the opposite of dieting. It's very anti-diet. So that's one kind of unique flavor to these things. So I'm going to end the video and went a little bit longer than I expected. I wanted to do these 10-minute videos, but as season 2 of the podcast continues on, I'm sure I will figure out what is working. So please like or subscribe to the channel. Leave a 5-star review. That helps a lot as well if you're listening on the podcast. Anyways, I'll probably do an outro to this podcast. I'm supposed to do outros. I'm holding myself to a standard. So I'm just going to end right now. And thank you so much for listening. I really appreciate your presence and support. Let me know if you have any other questions. And be sure to head over to Eating Enlightenment. You can take the quiz and understand the different criteria for binge eating disorder. This quiz takes the 13 different diagnostic criteria of the DSM-5. So it's the medical clinical definition that's used for insurance purposes. And it asks you if you have binge eating disorder. And if you don't have binge eating disorder, then it kind of estimates where you're at: compulsive stress, emotional eater. So check that out at eatingenlightenment.com. Lastly, if you're watching on YouTube, there should be a playlist where I've interviewed close to 40 experts now that have really paved a lot of understanding about eating disorders. They've gone through it themselves. They help people. And so that playlist is above. Again, you can subscribe. All right. Thank you. Namaste. Thank you so much for listening to what's going on in this upcoming season. I'm very excited for everything that's going on. As mentioned, check out eatingenlightenment.com. Eatingenlightenment.com. It's got a great blog, and there's a binge eating disorder quiz which reviews the 13 different criteria of binge eating disorder according to the diagnostic manual, the 5th edition, which is used to give the clinical medical definition of binge eating disorder. And the quiz will tell you if you have that or if you likely have it, as well as give you an estimate about stress eating, emotional eating, compulsive eating. It's just a quick quiz. That's at eatingenlightenment.com. Really appreciate your support. Have a great day.